Hello, everyone, and welcome to the Arthritis Action Podcast. I'm Marc, as always, your host, and today I'm joined by someone who, if you've been listening to this podcast for any length of time, you will probably recognize. It's Dr. Wendy Holden joining us again. So, Wendy is an honorary consultant rheumatologist at North Hampshire Hospital's NHS Foundation Trust, specialising in arthritis and pain management, and is also the medical advisor for Arthritis Action. So, welcome back, Wendy.
Thank you very much. Lovely to be here. Thank you for asking me.
Always a pleasure to have you join us. So today's topic is something that it's actually been requested a few times by several different people. So I'm really happy to finally get to do this one for you all. In this episode, we're talking about pregnancy and arthritis. Now, this might shock you, Wendy, but my knowledge of pregnancy is quite limited, as a man with no children or female siblings. So I'm going to be heavily relying on you for this one.
Fair enough. Fair enough. I have done it. I have been there. So I know some of the things that can happen.
Excellent. Good. So I suppose a sensible place to kick off would be, because obviously this is all going to be kind of centered around people with arthritis and pregnancy. So, I mean, will you experience like different symptoms, or will your arthritis start to affect you differently during pregnancy?
Yes, I think it sometimes can. So one thing I wanted to say was lots of people assume that pregnancy is a time of weakness or vulnerability for women, but I see it in a completely different way because it's a time when for example, your heart is growing. You have to sustain another being, so you become stronger in your heart. Your muscles become stronger, assuming that you don't sit down and do nothing. Your lungs develop more. You're able to take more nourishment from your food. So in a way, your physiology is in many ways absolutely optimized when you're pregnant. So for many women, it's a time when they feel good. However, with arthritis, one of the most tedious things I think when you've got arthritis is that it's often a good idea to plan pregnancy rather than just wait for nature to take its course. And that's because when you go into pregnancy, it really is like running a marathon or climbing a mountain, and you need to be strong. You need to have your nutrition optimized. You need to be thinking about your medication, and obviously you need to be reducing your stress if you can, sleeping as well as you can, and just being as good as you possibly can be for that other being that you're going to be nourishing for 9 months. So it's pretty tedious for people with arthritis to have to plan for that eventuality. But like all things, if you do, things are going to go better than they would have before, hopefully, without planning.
And hopefully, if anyone who's listening to all of our stuff or visiting our resources and whatnot, we're always banging on about the importance of planning and why you should be doing it. So hopefully everyone who listens to this is already doing loads of planning.
Absolutely. Plan, think ahead is the way. Yeah.
As you said, the body's operating at a much higher level during pregnancy. Does that then make a difference as to whether it's osteoarthritis or rheumatoid arthritis?
Yes, I think so. I mean, obviously, pregnancy is a young person's condition, but there will certainly be people going into pregnancy who've got issues with osteoarthritis in joints, especially things like hips and knees, which clearly are weight-bearing joints. And they are going to be taking a lot of extra pressure even if you only gain 10 kilos, which would not be very much weight in pregnancy. So your joints are going to be taking extra pressure. That's for sure. So it's sensible to do all those things that we always advocate Arthritis Action to be, keeping them strong, exercising and so forth, but taking everything reasonably. So you may remember, Marc, the marathon runner Liz McColgan, who famously ran all the way through pregnancy, right up until the day of delivery. Don't know how on earth she managed to do that, but clearly it is possible. And there were no issues with her pregnancy. There isn't a problem with exercising in pregnancy. It just seems like an unbelievably superhuman feat, that. But I don't think anyone needs to feel guilty if they're not running marathons until the day they give birth, because it is a time when, you've got to be looking after yourself, of course, as well, haven't you? So it's everything in reason, really, I think. In terms of inflammatory arthritis, there's a lot more planning and a lot more things that can potentially be an issue. However, you will already be plugged into the medical system in some way. So you will already be having your rheumatology appointments. And then if you're of childbearing age, hopefully this issue will have been raised at the very beginning when you started your medication, you started your journey. So you will know that there are things that are going to change.
Yeah, I wanted to ask about medication with that because I'm assuming, I mean, I don't know the ins and outs as well as you do, of course, about rheumatic drugs and pregnancy. I mean, is there some people would have to stop taking, or is there?
Yeah, exactly. I mean, broadly speaking, there's almost no medication that you should take in an ideal world if you were pregnant. However, needs must. So, what is usually recommended is drugs like anti-inflammatories, which are obviously one of the first drugs that are used for things like osteoarthritis and inflammatory arthritis. They should really be stopped as soon as possible after conception or pre-conception, if at all possible, because they can affect implantation. So those drugs are best avoided at the beginning. The problem is lots of people need those drugs. So I think the message is generally, if you find you're pregnant, just stop them as soon as you possibly can. And then so you would leave those particular drugs off for the first trimester, and then you can resume them again if you need them when the brain and so forth of the fetus has developed. And then you need to stop them again close to labour because they can increase risk of bleeding and other things as well. So it very much depends on what drug you're talking about. So no drugs would be the ideal. On the other hand, if you've got active inflammatory arthritis, you're going to need drugs all the way through pregnancy to keep that under control, because we know that inflammation is very bad for pregnancy and for developing fetus and for pregnancy outcomes. So it's vital to get that inflammation down by whatever means necessary, basically.
Right. Would you talk to your rheumatologist about this if you're planning on getting pregnant? Would that be a good person to talk to?
Absolutely, absolutely. So as soon as you start thinking about it, you need to have that conversation with your consultant or your rheumatology nurse or whoever you're seeing, and they can best advise about medication. If we're talking about inflammatory arthritis, there are some medicines, for example, I'll just name one, sulfasalazine or hydroxychloroquine, which are safe throughout pregnancy. So those drugs
Okay.
don't need to be stopped. Similarly, most biologic drugs, especially anti-TNF drugs like adalimumab, don't need to be stopped through pregnancy and breastfeeding, but others most definitely do. Some are associated with, for example, congenital malformation. So they need to be, drugs like methotrexate would be the main one that needs to be stopped. It used to be said that you should stop that 6 months before trying to conceive, but these days they're saying at least a month. So that window has come right down. So it's not quite as bad as it used to be. The other thing to think about is people often ask about men as well, but there isn't any. The only drug that it's the opposite, really. Sulfasalazine is safe for women, but it can reduce the sperm count in men. So that might need to be adjusted. That's often not known. I mean, it's not a reliable form of contraception, but that's often something that's not known. However, none of the other drugs like methotrexate need to be stopped prior to pregnancy planning for men.
Okay. I mean, to be honest, I actually only thought, but I don't think I wrote any questions down about men. I'd completely ignored them for
Yeah.
this episode, really. I do forget that they are involved in some way, aren't they?
Yeah, exactly. I mean, obviously there are men with inflammatory arthritis, and there are women that have partners, so they need, who might be on those drugs. So yes,
I guess probably same for them if you are thinking about doing this. Again, men, speak to your rheumatologist about this if you are planning
yeah,
pregnancy.
exactly. I think probably in practice, what would happen if you're thinking about pregnancy, you probably wouldn't be started on that sulfasalazine drug in the first place, or if you are a woman, you would not be started on methotrexate or one of the other drugs that aren't safe through pregnancy. You'd be started on something that is okay. Yeah, absolutely. It's not really something that comes into your head when you've got swollen joints and you're just going to start the medication. But I think the right thing to do is just, like we said, plan ahead. If you're of that age, then somebody should be asking you that question. That's the right thing to be informed about right from the beginning.
Excellent. Uh, Is it true, as we're speaking about inflammatory arthritis, is it true that symptoms can actually ease during pregnancy?
Definitely. For many women, for about half the women with inflammatory arthritis, with rheumatoid, for example, will go into remission during pregnancy. We used to think it was all women, but it's not. So, of the remaining half, about a quarter will stay the same, and about a quarter could get worse. So it's variable, but you've got a good chance of your arthritis easing during pregnancy. We don't really understand why that is, presumably something to do with the hormones. I would imagine everything is hormones, isn't it? In that
Yes,
in that
yeah.
situation. Yeah. Then otherwise, conversely, after delivery, about 6 weeks after delivery, this is the hormone evidence again, when the pregnancy hormones drop, that's a time when flares are very common. So all the rheumatology teams need to be ready for that eventuality. So supposing a woman has come off all her medication and she's okay, she may get a flare around 6 weeks after birth. So that often needs some emergency treatment. Just when you're feeling the most terrible that you possibly can be with a screaming baby and no sleep, then your arthritis kicks off. So it's really important to think about that as well. And if possible, get yourself an appointment booked in around that time.
Okay. Well, I mean, that's actually another thing I haven't considered many things in this episode, but one thing I haven't. When can like people go back on their medication? Because obviously you said they'll stop during the pregnancy. When
Yeah,
is it okay to
yeah,
go back on it? Is it like the second the baby's gone, or do you have to wait
yeah.
a different period?
No, so if somebody's come right off all of their medication, that would not necessarily be the case. But if you come right off your medication or reduced it significantly, what will happen after childbirth is you will take a wait and see approach and see, if you have a flare, you're going to need that dealt with. But lots of people find that the situation is different somehow after having a baby. So it very much depends. So certainly met some women who haven't needed to go back on their biologic. Some people who weren't on a biologic before have then needed to go on a biologic. So everybody's very different in that regard. So you just need to keep in touch with the rheumatology team and make sure you're not ignoring your symptoms. Just you have to look after yourself in this time. In general, the principle for arthritis during pregnancy would be to get the arthritis under control and then reduce the medication as much as you can during that time if you're not going to be able to come off it. Some women will find that their arthritis flares significantly, and then they will need to continue on their biologic, even the ones that are not necessarily advised, or even add something like steroids, because the key thing, as I said, is getting the inflammation under control. It's all about risks and benefits.
As like the symptoms can go into remission during pregnancy, then is it possible that they then stay gone after birth?
Sometimes things can change. Yeah, sometimes things can change. I mean, the general view on rheumatoid is that you will have it for life, but there
Yeah,
are fluctuations, flares and remissions, for example. So things can definitely change.
interesting. Are there any issues or complications that can happen during pregnancy because of a mother having arthritis?
Yeah,
It's
yes,
kind of a two-part one for this. So,
yeah.
both to the child and also to the mother as well. Like, I'm assuming there's different.
Yeah, absolutely. So osteoarthritis essentially should be straightforward, apart from
Mm,
increased pain in the affected area and potentially then some issues around the birth process. We're going to talk about that a bit later on. In terms of different kinds of inflammatory arthritis, as long as the arthritis activity is stable, then there should not be any issues. Other conditions, for example, like hypermobility, which does strictly speaking is not arthritis but is
mm,
a MSK condition, can certainly be a problem during pregnancy. So people who have extra flexible joints will have even more flexible joints during pregnancy, because obviously that's the purpose of the relaxation during pregnancy, is to enable the pelvis to expand. So all the
mm,
ligaments will gradually soften. So joints might become more unstable and potentially dislocate more easily. Pubic symphysis dysfunction, which is pain around the front, where the
mhm.
two bones at the front of the pubis join, can again become unstable. Those two bones have to move apart during childbirth. So in people that have got unstable areas anyway, there a lot of pain can ensue, and back pain as well in hypermobility. It can be a real issue. The other thing is certain types of inflammatory condition, for example, things like lupus and connective tissue diseases, are associated with a procoagulant state. And by that, I mean a tendency to blood clots. And pregnancy is already a state where blood clots are more likely to happen. And that's for obvious reasons, because otherwise women would die in childbirth of blood loss. So in pregnancy, you are more likely to have a blood clot in your legs or in your chest, for example, than a
Mm.
non-pregnant person. And if you have a condition like lupus, then you may be extra prone to blood clots. Similarly, with lupus, you may be prone to kidney problems. If you've got issues with your kidneys already because of lupus, then pregnancy can be a challenging time. And so you will have a high risk pregnancy, and you will know that, and you will be under the care of lots of specialists to keep an eye out and make sure things are going according to plan. So those would be the main things I think in terms of the mother's health. Yeah.
Okay, no issues necessarily for the child or fetus.
The main risks for the fetus are inflammation. So inflammation is associated with reduced fetal growth and early labor. And hypermobile women with Ehlers-Danlos, for example, can have preterm labor or unstable. They can have premature rupture of the membranes, in other words, so the waters can burst before they should, and that's why labor can happen early. So that's the main risk with that, but not really for inflammatory arthritis.
Okay, good to know. What are the chances of a child inheriting the mother or father's arthritis?
Yeah, that's a great question, because as parents, you just feel guilty about everything the whole blooming time. And lots of pregnant women ask that question, is my child going to inherit my arthritis? And that the news is really good on that. So we know, for example, in twin studies, so if you take identical twins, one of whom has rheumatoid arthritis, you would imagine the identical twin would also have a high risk of having rheumatoid arthritis, but the risk is only about 15% in the second twin. So we know that environmental things are more important than genetics, much more important than genetics. And that's with twins. So the risk in a child of a parent with inflammatory arthritis is generally much lower, which is good. The exception would be conditions like ankylosing spondylitis, or people who've got these conditions will know what that means, or spondyloarthropathy, which is strongly associated with a gene. And identical twin studies in those people find that you have about a 50% chance. If your twin has got the condition, you've got about a 1 in 2 chance of also having it. So that the risk is much stronger for those conditions. But again, with a parent, that is absolutely not inevitable at all. So I think the broad answer is it depends. It's possible, but environment is much more important.
Excellent. That's a good one to know. I get asked that one all the time about
Yeah,
it.
exactly. It's a parent guilt thing. Can't really blame your parents for that for certain situations.
I say it's a parent guilt, and also I get it asked. My mum has arthritis. That means she's given it to me.
Yeah,
Okay,
yes,
that's that way.
exactly.
Oh, she's not done this deliberately. Okay, let's maybe not have a go at your mum about this.
Exactly.
One thing we haven't talked about yet is, again, during the pregnancy, are there any things like dietary or supplement changes you should make? Because, again, some of these are
Mm,
random things. You hear so much about all
mm.
diet stuff in general.
Yeah, you do. You do. And I mean, obviously, the best thing to do is to eat healthily right from the start. So, what is good for you is going to be good for the baby as well. The problem is, if you're throwing up most of the time, it's a
Yeah.
bit difficult to get something nutritious in. So, you're just going to have to go with the flow a little bit and get in whatever protein and nutrients you can from a natural kind of diet. So, following all Martin's advice on that subject is a good thing.
Mm.
Folic acid is a good idea. Vitamin D is a good idea. Iron, if you're tend to be a little bit low on your iron.
And
And
that doesn't
obviously,
mean have a pint of Guinness, because that's a myth.
no, that is exactly a myth. Obviously, no alcohol in pregnancy is what we're aiming for there, because alcohol is a poison for sure. Yeah.
I'm pretty sure my mother did that. Maybe I shouldn't mention this on the podcast, but that was back in the day when a pint of Guinness was supposed to give you a good dose of iron.
Absolutely. Yeah, absolutely. Not so long ago, many women were drinking through pregnancy. I agree. Not as bad as smoking, I suppose, but
Oh no, absolutely, yeah,
yeah.
definitely. As if we need to tell you that still, but just in case you didn't know, don't do that
Yes,
during pregnancy.
yes.
So throughout the pregnancy, this is the last one, and before we move on to things like the delivery and
Hmm.
what happens after that, is there any like differences between the different stages of pregnancy? Like you said, throughout that 9-month period, are there different
Mm.
factors that need to be considered for people with arthritis during that, or is it just kind of the same as everyone else, really?
Yeah, I think it's the same. I mean, as we've discussed, the drugs are important, especially at the beginning. The middle period is generally a period when women are starting to feel better, can be exercising, got more energy. Early pregnancy is a time when many women feel absolutely exhausted and won't be able to hardly do anything, let alone exercise. So I think if you feel that way, you got to listen to your body and just do what you need. If you feel like you need sleep, you've got to do it. And then again, towards the end, when things are getting a bit heavy and achy, you've got to just be commonsensical about all of this. Maybe gear your exercise down a little bit. But in general, no, there's no difference really between the stages, I'd say.
Excellent. That's good to know then. I suppose let's move on to the birth itself now then. You've already covered some of this with like talk about like hypermobility in the joints, but I
Mhm.
mean, especially because one thing that did sort of strike me is things like hip replacements. If someone's had a hip replacement before.
Yeah.
Would that be an issue?
Yeah, so that's not necessarily going to be a problem because often young women who've had hip replacements have been given extra flexible joints, new joints that will allow the hips to expand. So it's absolutely not necessarily a problem, but it obviously depends on what the issue is. So if you've got hips that have not yet been operated on and that might be very painful and stiff, that could be more of an issue. Or if you've got a condition that's caused fusion in your spine, or if you've had a spinal surgery, your back may be really uncomfortable. If you've got a very small pelvis naturally, again, that might be a problem. And that's something to discuss with your obstetrician before the birth. Childbirth is a scary time for any woman, and you don't want to be worrying about these things too much during the labor. You've got other things to think about. So, in a way, although cesarean is not necessarily what most women want, if it's going to make it easier and they're going to take away the worry, then I would just go with the flow on that one. Most obstetricians will want most women to give birth naturally if possible, if they can.
Okay. This one's very subjective, but would things like, because obviously a lot of pain comes with arthritis a lot of the time, would the pain levels of a birth perhaps be a bit different if someone had osteoarthritis or even rheumatoid arthritis as well?
It's an interesting one. I don't think so. One thing I forgot to say, one of the great things about pregnancy is that pain threshold goes right up. Those pregnancy hormones are really good for helping women manage pain. So I mean, obviously it's the most painful thing that will ever happen.
As I say, it sound very
Yeah.
good still from what I
No, 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 it still
remember.
isn't. But they've done lab experiments on pregnant women and even women during labor, and they can withstand pain that they wouldn't have necessarily been able to withstand before. So there's something about the pregnancy hormones and adrenaline and so forth that is very good. So I think that it's not in practice, not an issue with arthritis during labor.
Excellent. Well, that's very good to know then. Again, I know you've already said that people are off medication like at that stage of pregnancy after including to up until and after the birth.
Mm-hmm.
When it comes to things like breastfeeding,
Mm-hmm.
will that then, I mean, obviously assuming you're not on any medication at that point, but if you were, like it's
Yeah,
one of those ones that you do stay on, is that
yeah.
an issue for breastfeeding?
For many drugs, absolutely not. So many drugs are completely fine through pregnancy and breastfeeding. Certain ones you shouldn't resume if you're going to be breastfeeding. For example, methotrexate that we spoke about before, but you wouldn't be on that anyway through pregnancy. So the issue is obviously, do the drugs get into breast milk and into the child?
Hmm.
Most of the biologics do not get into breast milk, so they will usually be okay through breastfeeding. So not necessarily is the answer.
Okay. Obviously, as the systems are quite sort of intertwined, as you say, like with your rheumatologist and the obstetrician would be the next one they'd be
Mm-hmm.
seeing. As those systems are quite well entwined, does that then kind of go on to the child and following on from that afterwards? Are the systems all embedded together so that there's continual care through that arthritis and childbirth journey together?
Yeah, to some extent, there is some integration. So, if, for example, you have a woman with a high risk pregnancy, so for example, with lupus and kidney problems, then you would be speaking to their gynecologist and obstetrician all the way through.
Hmm.
They will be totally integrated. For other women who are, even if they've got inflammatory arthritis, they may well still have a low risk pregnancy. You would just have minimal contact with the obstetric team. But then again, you may well need to. I've certainly had to go to the labour wards afterwards on several occasions to deal with issues that have arisen after pregnancy, for example, to do with joints. So it depends is the answer. I think most rheumatologists at any one time will have a few of their patients who are pregnant, and they will know when the time is coming, and they'll be ready to deal with that.
Excellent. This goes back just something I thought about when we were talking earlier on about if parents can pass on arthritis, like the
Mm.
hereditary nature of it, or if there is one. How soon can you test for something like rheumatoid arthritis?
Well, there isn't really a diagnostic test for it. You would just know if you
Mm.
develop symptoms of it. So it's a clinical diagnosis based
Mm.
on symptoms with joint swelling, for example, and blood tests and signs, really, when you see it, when you see a patient. So there isn't, you can diagnose rheumatoid, obviously,
Yeah,
that's
so
easy, but there is not a test you can do in advance of developing symptoms, if you like.
yeah, so perhaps I should have more stated is things like, juvenile arthritis and things
Oh, I
like that.
see.
Yeah.
So that's a completely different type of arthritis
Mm.
that is not necessarily associated with anything previously or in the parents. So you would just know that if your child, for example, developed a swollen knee or a swollen ankle, then obviously you'd be seeking some medical attention for that, and that it'd be diagnosed at that point.
Okay, cool. So when does the body start to go back to normal after pregnancy, like after delivery, rather?
Yeah, great question. So, mm, as we've already discussed, pregnancy is a time when all the ligaments will gradually soften, and that takes about 9 months to happen. So, it will take about 6 to 9 months for all of that to go back to normal again. So, it's very common to get a bit of pelvic pain or hip pain or generalized joint pain after delivery that just kind of drags on a little bit. In fact, that's called postpartum arthralgia, which means joint pain after delivery. So that's a common thing. So that will usually settle 6 to 9 months. If you're breastfeeding, that keeps the hormones high. So that will extend that period. So it could go on if you're breastfeeding for a year, that period of softer ligaments and joints could go on for another 6 months or so after that. So it can drag on a little bit. But it's the good news is it will get better.
Excellent. Is it possible actually to develop arthritis from childbirth, like whether like sort of the changing of the structures within your hips and pelvis?
That's a good question. I don't think so. I no, I don't think so because this, I mean, this is a natural thing that women have been
Hmm.
doing for, millennia. So no, I think something would have to go very badly wrong for that to be the case.
That's good news then.
Yeah.
Good.
Yeah, absolutely.
Okay, we'll go through some little tips just to kind of round this one off then, I think. So
Okay.
we'll do it through the three stages of it essentially. What would
Yeah.
be your top tips for anyone's planning on or wanting to get pregnant with arthritis?
Think ahead. Be your best person.
Excellent. And what's your tip for during pregnancy?
Eat as healthily as you can and try and exercise where possible.
Excellent. And finally, after the birth.
I think get as much sleep as you can because that's so important. And look after yourself. Also, through all of those stages, stay in touch with your rheumatology team because they're there for you. Don't feel guilty if you need to call them. I'll keep calling them if they don't call you back.
Lovely stuff. Great. Thank you very much, Wendy. Brilliant. Yes, if you want any more information on some of these topics, please do have a look at our website because there's some information on there for it. There's a link in the episode description below. And of course, always please do share, follow, subscribe to the podcast, tell everyone about it. Give it a good rating if you can, because that helps people to find it as well. And yeah, we hope that you continue to tune in. And if you have any topics or anything like that, this one was a request from listeners. If there's anything you would like to hear on the podcast, drop us an email. That's in the episode description below. Just get in touch with us. We'd love to hear what you guys would like us to be talking about on these. So thank you very much, Wendy. As always, it's been a pleasure talking to you.
Thank you. Very good fun as always.
Excellent. And thank you everyone for listening. Bye-bye.